Welcome to the Titans of Palm Beach with your host, Jay Oliver, on 95.9 and 106.9, the True Oldies channel. Talking with the movers and shakers that make South Florida as amazing as it is. Now, here's your host, Jay Oliver.
And a very good morning, everybody. Jay Oliver here. Another edition of Titans of the Palm Beaches. And that's where we explore the origins of it all. How the individual actually got to the success point where he or she may be at today. Very special guest. We have in studio Dr. Alla Weisz. She is a personal primary care physician, and she's part of Weisz Concierge Medical in beautiful Palm Beach Gardens. And we welcome Dr. Weisz to the airwaves here at the True Oldies Station. Welcome aboard the Titan Show.
Thank you, Jay. Great to be here.
You know, one of the things I'd like to explore is the origin of it all, as I just stated. I want to know a little bit of background regarding Alla Weisz. How did you always want to become a physician? Talk to us about that.
Thank you. I'm a third-generation physician. My grandfather and my father were physicians in the former Soviet Union. Our family came here to the greatest country in the world, to the United States, 25 years ago. We came here legally as Jewish refugees. And originally we settled in Indianapolis. This is where the rest of our family started.
Indianapolis from the Ukraine. Give me the connection there. It's somewhat unusual, but I'll go with it. But give me an idea how you ended up in the Midwest.
Definitely. Greatest area, greatest city, Indianapolis. Great place to raise a family. And my mom's family came there first, so we basically joined them. And that's what the whole point of this, to unite families. So, but after living in Indianapolis, I had my own practice there for a while.
How many years, Dr. Weisz? How many years?
About 5 years.
Okay.
But before that, before we go to all of this, as a doctor coming from another country, you really have to go first to undergo really all the training all over again. You have to take American boards, American exams, and go back to the residency program. I spent my residency at the Indiana University Family Residency Program and received the great training, and then had private practice there for about 5 years. And in 2008, our family moved to Florida. We always want to live in Florida. So, and in the past 10 years, I worked for the greatest organization, Great Urgent Care. But as every American, and especially a former immigrant, we always wanted to have our own business. I always wanted to have my own business. I always wanted to have my own practice. And I feel that this is the right time for us. I feel that now we can do it, and that's why we're starting at this point.
Excellent. And you know something? I could only imagine the differential in weather conditions. From Indiana to Florida, you have to love the winters down here.
Absolutely. We love our hometown. We go there at least a couple of times a year, but we cannot wait to get back to paradise.
So it's all about the business and everything. You had your own practice, Indianapolis. You studied. Was there a specialty that you once aspired to be in, or is it just kind of in a general practitioner type of way?
I'm a family practice doctor, family practice board certified and recertified. I recently went to receive my Master's of Business Administration because I always wanted to study business. I went to Kaiser University here, just down the street from us, and studied there for 2 years, received my MBA last year.
Very nice. And that leads us to where you are today, which is right, ladies and gentlemen, on Burns Road in Palm Beach Gardens. It's the Weisz Concierge Medical, personal primary care, 3375 Burns Road in Palm Beach Gardens. Give the audience a little bit of an idea. You know, they hear the word concierge coupled with medical. Give us an explanation what that's all about.
We are a brand new practice. We are the only one in Palm Beach Gardens, actually, that restarting concept of direct primary care. Direct primary care is really, it's actually an type of old type medicine that used to practice, and it's an adaptation of the old concept where the relation was exactly between the doctor and the patient. We are not accepting any insurances, and we only our model is based on membership. Okay. Patients pay a monthly membership or annual membership, dependent on their desire.
So it's their choice to either go monthly or for a yearly type fee. So in essence, there are only a few in the state of Florida. Give us, as far as locales are concerned, you have one of them here, obviously, in Palm Beach Gardens.
Right. The first one, we are the first and only one in Palm Beach Gardens. After doing certain survey, we figured out that would be the perfect area to place it. There are a couple of practices like this up and down the coast from us, but we're the only ones. Really, that direct primary care gives family doctors a meaningful alternative for the standard fee-for-service insurance billing by we having direct relationship between us and a patient. Direct primary care is not a substitute for insurance. Patients still, the ones that don't have insurance at all, are recommended to have some type of catastrophic coverage, something that
just in case of an emergency situation.
Exactly.
Right.
Or patients who have insurance, they're encouraged to continue have their insurance. So direct primary care is not for everyone. But for patients or for the employers of small businesses who cannot afford to buy and have a medical coverage for their employees, this is where we come in. Direct primary care bill actually was passed by Florida Senate last year and came into effect. And reading directly from what it means, direct primary care is a primary care medical practice that eliminates third-party payers from the primary care provider-patient relationship. So we do not charge insurances. We don't accept Medicare. We opted out of Medicare.
And there's so many different types of programs as far as insurance is concerned, so it can get a little befuddled as far as coverage. What you offer is somebody, it's like almost going to a gym in which you pay a monthly fee. You can go in as many times as you want. Is that the same concept as far as concierge medical is concerned? Can somebody see Dr. Alla Weisz, 6, 7, 8 times in a month?
I love your comparison to the gym. It's exactly what it is. Direct primary care allows the easy access, affordability, and really the continuity of care and familiarity with the same physician. We're providing basic primary care needs. We're providing annual physical exams and all your other primary care needs, acute care for the chronic conditions, and all of this for the monthly fee of $150 for adults over age 26 or $80-something for the adults 26 now, or younger.
Dr. Weisz, can a patient, do they have to commit to you if they want to do a month-to-month type deal? How does that particularly work? Can they go as they want to as far as the monthly situations are concerned? How would that work as far as concierge medical?
We encourage patients to sign up to be our members. We usually ask them, typically we ask them to pay 3 months upfront for our membership, and after this to continue on a monthly basis, on a quarterly, biannually, or annually basis.
$450 up front would pretty much cover them, and then they can kind of break it down as they wish as they go forward, is what you're saying.
Exactly. And if patient at some point decides that something like this is not for them, we'll be glad to, after giving us a 30-day notice, we'll be glad to refund the remaining amount, and you can certainly go ahead and continue with the standard traditional primary care. So working in the urgent care, long hours, seeing other traditional primary care offices, I felt that it's really not for me. I wanted to treat patients the same way I wanted to be treated. I wanted to give patients the time, the care that they deserve. So by practicing really direct primary care, we can limit our panel to only 300 plus patients. It's not going to be 2,000 patients. Our panel would be, once it's full, it's going to be closed. But by doing so, as you said, membership for $150 a month, basically less than my cable bill, patient can come into our office and have unlimited visits. Our visits usually are about an hour and a half, as long as needed. Patients can come and see us, basically calling us today. Most likely we can get them in the same day. We also, for the patients without insurance, we will arrange for discounted laboratory work, discounted radiology services. We have contracts with all of those.
I was going to say, that all has to be farmed out, blood work and everything else. I mean, blood work is done in labs in and around the area, correct?
We draw blood work.
You can draw
We draw blood work in my office. I have a wonderful medical assistant that is starting very shortly. We're very lucky. She used to work in the lab for many years. And also with all the other specialists. And we're going to draw blood in our office. If patient doesn't have insurance, we have very discounted prices for those patients. For patients who have insurance, insurance will be billed for the lab part of that.
Gotcha. So the blood is drawn, and then is it looked at within the confines of the office, or is that done
It's sent
elsewhere?
to the lab.
It is sent to the lab for readings and everything else, panels,
Right.
everything else. What about x-rays? Are x-rays done within? How does that work out?
We don't have x-rays in our office, but once again, we have contracts. We have special arrangements with the radiology services, with the radiology, several departments, several offices, and where they can give our patients really very discounted rate. And all the reports come directly to us.
Well, this is a tremendous concept. And, when I first met you, I was so intrigued by this because, I had that correlation again, that gym membership / medical doctor in which, you have that one-on-one as many times as and let's face it, a lot of people that like to have those one-on-one relationships with their physicians, the more at ease, the comfortability, that type of thing. So that's one of the first things I thought of. You don't hear about this, but it's a tremendous concept in order to develop those one-on-ones, right? I mean, pretty much.
That's exactly right. That's a different type of medicine. Once again, going back to the old way, to the way medicine is supposed to be practiced, to the way why most of us became physicians in the first place, because we wanted to take good care of our patients. We don't want to be an assembly line, as in our famous episode of I Love Lucy segment.
Which is great, and I want you to explain that concept, the I Love Lucy conveyor belt. Everybody remember that, ladies and gentlemen, with the chocolates. You had Lucy and Ethel with their garb on, trying to put the chocolates or take the chocolates off the conveyor belt, and all of a sudden the conveyor belt is sped up and everything else. That's a great reference. Explain that.
And they couldn't keep up anymore. And even though they tried very hard, all of a sudden the supervisor says that they were doing so well, and only to increase the speed of this conveyor. So this is similar. This is how we feel similarly about traditional practice of family medicine.
Now, here's the other thing I like about this. You say that there is a cap as far as once everything is established and everything else, you'll have a certain amount of patients. And I kind of like that because sometimes, you go into your doctor, he's got 1 million patients waiting in the waiting room. Sometimes, you know what? You kind of lose that one-on-one touch because he's seeing so many people now. In this day and age, so many things have changed regarding physicians as far as insurances and now part of conglomerations. And all of a sudden, you've lost that one-on-one touch, which you treasured for years. Well, now you can get it back. You can get it back, folks, with the Weisz Concierge Medical, because what Dr. Alla Weisz is saying is she will develop that one-on-one relationship with you to come in and see her as many times as you wish in a month. And there are a lot of people who need the care from a medical standpoint, right? It takes more. You're going to see her on a Monday. Guess what? She might want to see you again on the following Tuesday and then on the following Wednesday because you might need that care. And the thing I like about it also is you go into these doctors' offices now, and it's copays after copays after copays, and you wonder. I love the fact that it's just a set price point per month. Good.
And I'm glad that you brought it up, Jay. That's excellent point, because if you summarize put together all of the copays, if you calculate them, add them up, it's really what you're paying into direct primary care, which is $150 a month, would be much less than a cup of coffee a day, or definitely all of the copays. Yesterday, we just officially opened a couple of weeks ago, and we already do have a couple of patients sign up, more than a couple. And one of the patients told me, I've never heard a doctor answering the phone phone. Well, I'm answering the phone now because medical assistant is coming. But also, I never had doctors sitting with me and talking to me, asking me about my family, my future, my everything. But we are able to do it because we are not we taking insurances and including the Medicare out of the picture, and we are offering one-on-one care. That's how I would like to be cared. We also go to patients' homes if they cannot come to us. If they have trouble with transportation, we can come and do home visits. When patient is getting admitted to the hospital, even though if I don't have privileges, if we don't have privileges at the hospital, we're still able to come and make a social visit to the patient to oversee their care.
It's a fantastic idea. It really is. And there's no two ways about it. I mean, how many times does anyone go into a doctor's office, okay? You're in the lobby with maybe 10, 12 other people. You kind of get a feeling of, okay, I'm getting a little antsy. But now you have a situation where you can develop a relationship, a rapport, the camaraderie to exist between physician and patient. Okay, that's something, folks, that has been lost in the decades that have passed. Way back, it was there. I mean, my grandfather was a physician in the Bronx, okay, in New York. He had that one-on-one. This, to me, you're bringing that very special doctor-patient relationship back. A lot of people crave that. A lot of people want to talk. They don't want to be examined. They don't want to sit in a lobby for 30 minutes. You know, if you have 1 o'clock appointments, sometimes you don't get in there till 2. How many times has that happened to somebody? They want to get in. They want to look forward to the one-on-one situation with a doctor. They want to be able to talk after a diagnosis is given. What one has to do to improve. You get that with Dr. Alla Weisz here over at Weisz Concierge Medical. You get that. It's something that was lost, but I love the concept. I hope I explained it right in that regard.
Excellent. You're doing a great job. You're doing a great job, Jay. So go back again. The direct primary care, actually, a concept of this comes out of the Pacific Northwest. One of the fathers of the direct primary care is Dr. Garrison Bliss. He started this whole. I wish I could have invented this. I wish I would have started that. He wanted to give patients and small companies, once again, the ability to have their primary health care needs met affordably, quickly, comfortably, and with the same doctor. That's the idea. That's the idea. But us not having a huge panel, we can have less panel patients, but we providing them with much different care.
Here's another one for you. So in today's day and age, and we are in an area in which we have more of an elderly population, let's put it that way, than other towns. And with today's situations that exist, whether it be in a situation of mind, talking about dementia, talking about Alzheimer's, talking about diagnoses that have to be made, elderly people need more care. Was that something that kind of played into your decision to not only come to Florida, but to start this in that regard, knowing that you would get a lot of health-type situations involved, and thus maybe developing that one-on-one that a lot of people would benefit from based on that?
That's exactly right. We just couldn't, as I said, the time was right. We always want to start my own business. I always want to start my own practice, and now it's the right time for us. But we couldn't bring ourselves to go back and just basically starting the same all over again. As you said, waiting in the room for 2 hours, then the entire appointment, you 10 minutes with the doctor sitting with their back on the computer. So none of this is taking place in our care. We know about our patients. When we send our patient to the specialist, we are calling our most likely specialist. We're sending them a special letter explaining what is it and why we're sending our patients to the specialist, not just blank forwarding the patient's notes.
It's an exciting adventure. It really is for you. I mean, somebody who's firmly planted in the field as you are, somebody who has come over from another country to the Midwest of the United States of America and now down into the state of Florida, into West Palm Beach in this area. I mean, this has been quite a journey for you. I mean, do you ever look back and kind of say to yourself, wow, I was from here, I went there, now I'm here. I mean, I've started this new concept. in the medical field. Do you ever kind of pinch yourself a little bit as far as where you were and what you've accomplished to where you are today?
Hard to believe, Jay. That is for sure. Once again, we live in the greatest country in the world. For sure, nowhere else will anybody will have an opportunity like that. And I'm certainly grateful for this every single day. We cannot find a bigger patriot than myself. And it took a lot of hard work. It sure did over the years, and
a lot of research to make sure that this concept would work for you here.
Certainly,
right?
and experience over the years working in the urgent care, working as I worked in the healthcare district here on the 45th Street. I worked as a medical director at the assisted living facility as well to keep with the primary care skills. Seeing them all, it felt like this is exactly what I wanted to do all my life from the very beginning. This is why I became a doctor, to provide this quality care, really, and be patient's advocate and be part of their family.
I think it's fantastic. I really do, and I think it's going to be a big hit. I really believe it. I think it's going to be a big hit, and I think people are going to fall in love with you because you're a very inviting person to begin with. And I can sense that one-on-one type doctor-patient relationship is really going to do everyone quite well here with you.
Well, you're very kind, Jay. You're very kind, and thank you. Thank you, first of all, for inviting me here. And we're very happy to have a chance to explain what is it that we're doing. And please stop by our office. Please call our office. We'll be glad to organize a meet and greet appointment and explain to.
Let's give the people the particulars here. You want to go to the website, folks, check it out, WeiszConciergeMedical.com. Now, remember, Weisz here is spelled Weisz. Concierge, Concierge Medical.com. Go to that website. You'll learn more about it. Dr. Weiss's practice is on Burns Road, 3375 Burns Road. It's Suite 207. In beautiful Palm Beach Gardens. We'll give you a phone number as well here, Doctor, for the folks. 561-802-7999. That's 561-802-7999. You call, you'll make an appointment, and you will change your life. And I can only think, folks, for the better. And once again, not to be redundant, going to an office, you've lost that one-on-one relationship. I have, many have, that I have known. It's time we get it back. We love this concept. We love you, and we can't thank you enough. I think you're going to be a big hit in West Palm Beach.
Thank you, Jay. Thank you so much for inviting me, and thank you for all your kind words.
I think we covered the bases, Doctor, so until next time. We'll certainly keep in touch with you on many fronts. We can't thank you enough. Jay Oliver here. You have been listening to another edition of Titans of the Palm Beaches. And that's where we examine the successes and the origin of it all to the successes of today, how one got to where he or she is today. Jay Oliver here. Have a great rest of your day. We'll see you next week.